We know that individuals who are socially disadvantaged, whether that's through poverty, through structural or institutional racism, when a disaster hits them, it usually hits them harder, hits them longer, and it takes more time for them to recover.
In the last year, right before COVID hit, we had been working on a project called the PICO Wellbeing Project. So we sort of had this wealth of data on where our community was when the pandemic started that could really inform where we needed to focus our efforts. It's really about that community connection is one of the top things that we've realized really is contributing to health outcomes both physically and mentally.
Our tribe has always had a very firm focus on preparedness in emergencies because we're in the tsunami zone. And so we have a very well-trained community. Most of our community members are CERT trained, thanks to our emergency management director. And we have multiple plans in place already. And I didn't even know this, but we already had a pandemic plan in place. And we had a continuity of operations plan in place. I think communication is just key, making sure that you have those opportunities for people to come in and just share ideas and build good, solid foundations for well-being.
One of the things I think that we've all seen has to do with broadband, and we've been discussing access to broadband in our state for quite some time, and no one really wanted to take it up and discuss it. And now that folks have had to do homeschooling, work from home, doctor's visits from home, all of a sudden it has come clear to our local leadership that really is something that we have to hone in on.
"2020 has not gone as planned, but interestingly enough, it has shown a light on our young leaders and how they are showing up and demanding a seat at the table."
We really push to try to adapt our own systems and also support the community as best as we can so that nobody feels left behind or left out during this process, because at the end of the day, we're all neighbors and we're all friends.
I was able to develop the after-school program called Wolf Den, where I worked with 2 other high school students to create a space for students to come after school and learn about social and emotional well-being and build their skills in that realm. And then once I graduated, I kind of passed the torch on those programs and allowed other high school leaders, youth leaders to step up and take those programs over. And my role personally this year has shifted quite a bit, and I'm working with a research team from the University of Wisconsin-Madison to study the experiences of Latinx students and their families in Algoma. So we're looking at their experience in the community at large, but also within the school district.
With regard to my position at the city as an intern is with the BLM movement, we've had a lot of different community discussions, and so I've been helping a little bit with that and with the census. I've also become sort of a peer advisor to the Gonzales Youth Council, trying to help the youth commissioners with forming their own youth council, how to establish a platform. I always felt really supported by adult allies.
Nothing for us without us. That's something that I go for in my work with everything that I do, just because if you really want to have success with something, get those people involved that you're trying to work with and target, because wisdom doesn't come with age, it comes with experience. So that experience that you've gained from your personal life, everything that you've lived through, is what allows you to be so knowledgeable and an expert in these projects.
It's so amazing to see how when I was in ECO, we kind of passed along that work, but they're still interested in that too. And so it's very youth run. And I think that is just amazing that our own community youth are very invested in wanting to know what the community is experiencing and what it could potentially look like for a lot of community residents here in Chelsea.
2020 hasn't been a great year for most people, and it's generated a lot of pain, like physical, mental, and emotional pain. But one thing that I know from the initiatives that I've been involved in is that pain can be a really powerful tool for change, and it can help to drive change in profound ways that other things just can't, because there's that like purpose, that passion behind the work that everybody's doing when there's pain behind it. And it's a great way to use it.
Everything that we're doing at the smaller scale is just going to keep going up that ladder and eventually spread out. And we're going to build a culture where everybody is welcome, everybody is happy, and everybody can make a difference.
About 11 years ago, when I started working at the health department, one of the first things we did was map our data and look at, where were we seeing high rates of infant mortality or teen pregnancy or sexually transmitted infection. And invariably, you would see aggregations of disease over the same communities, which happened to be our most densely populated, highest percentage minority, lowest income communities across the city. And I think I had a sense of that going in, but it wasn't really until the next couple of years of unpacking that with communities and talking to community residents and learning the history of this city that I was living in and learning about, where the past of Richmond really helped me understand the systemic forces that contributed to these massive health disparities. And then for decades, the disinvestment in those communities, in the schools, in the systems that were supporting those communities, you just recognize that over time, we have made a series of decisions and actions that have created the environment and circumstances that make it really difficult for low-income people of color to be healthy. And so it's understanding that larger context about what's at play that makes up this idea of systemic racism driving health disparities in our community.
At some point, not just in Broward, but in this country, you have to realize, you have to come to terms with the fact that there can't be something wrong with all of these people of color. Like literally, this has got to be about the systems and structures that are supposed to be designed to offer support, which are actually, whether intentionally or not, serving to oppress clients of color. We are actively working towards becoming an anti-racist governmental entity. And what that looks like is the establishment of the Office of Equity and Community Investment and a dismantling racism initiative such that we have brought a 2.5-day training program to our community so that we can establish a common language and analysis about what we're talking about. Because we're not talking about individualized prejudice and bigotry. We really are talking about systemic and institutional racism that is insidious, whether we recognize it or not.
If you just focus on intention, then you miss out on a whole piece of how systemic racism really plays out.
What COVID-19 did for us was bring front and center to the fact that health disparities kill people. People die. We have to take advantage of the momentum and that we're experiencing right now.
When I think about my own family situation, for example, in the Klamath tribes, my great-grandparents and their parents were put on reservations in their time. My grandmother was stripped of being recognized as a tribal member. This was only 2 generations ago. So it isn't that far from people's hearts today. And there is no moving on from that.
If ever there was a time for transformational change, at least in my lifetime, this has that feel to me, like a time when we can truly lift up the things that we care most about and hopefully see the kinds of changes across our nation that are so needed. One of the things we recognize and are recognizing more as a national philanthropy is that it's people in communities who are closest to the issues of inequity that we're talking about, who have the best perspective on what solutions need to be employed. As a nation, we're talking about issues of structural and systemic racism and its impact and the role that it's playing in both the economic crisis and the health crisis, and that gives me hope. The stories that I hear from all of your communities gives me hope of communities coming together to take care of each other.
We look to you to tell your stories because you know how to teach others and inspire other communities. So, so much of it is you already know the solutions, you know how to tell your stories. We can help you do that, and we try to help you do that. And I still think that's the secret sauce.
We are betting big time on policy change. We have recruited a new vice president for our policy unit. Whether this is a moment for significant change, whether there are ways to bring us together as a nation so that we fundamentally see the worth in each other and everybody.